Hey, what's up everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor, John Penisarata. Today, we're gonna be talking to you guys about sciatica. Now, there's a lot of confusion about what sciatica is, and a lot of my patients that come into the office say, I have pain right here. And then when a lot of people, when they come in, they talk to me like, I have this pain right here, and they call it sciatica. That's not true sciatica. Sciatica is a nerve pain that actually starts from this area and goes down past your knee. Now, one of the things that we want to do is give you 3 exercises that can simply alleviate your pain. Now, there's different exercises out there. There's more than just stretching. There's an activation technique that we want to do. Now, with sciatica, it's a nerve pain. So with nerves, one of the things that people don't understand is that nerves don't move. They glide. They don't contract, they don't pull, they don't push, they don't do anything. They glide between the muscles. And so what we want to do today is teach you how to floss. Like, think about flossing, how you would floss your teeth. We want to floss the nerve between the muscles so that way it can get a better glide, and that way it can reduce the inflammation and reduce the injury that you might have or the pain, tingling, and numbness that you may be dealing with. So today we're going to start with you laying down on your back. Now we're going to start in this position to see how much tension you guys may have along that sciatic nerve. Now some people may just lift their leg. Go ahead and lift this leg up into the air. A lot of people will lift that leg and you'll start to feel tension immediately down the leg. Now we want to back up off of that tension slightly. Now in his case, we're going to bend the knee. We're going to keep that knee slightly bent, not completely all the way down here, slightly bent, and to where you feel just enough tension. Now that stretch is not because you're just stretching the hamstring muscle. That stretch is that sciatic nerve that's going all the way from that butt muscle here all the way down your leg. So the first thing we want to do is, as his leg is, or that second thing we want to do is, as his leg's up, we're going to point your toe here. And as he points his toe, he gives a little bit of a slack off of that nerve. And as he's pointing his toe, he's going to look up, he's going to lift his head, keep your shoulders down, lift your head, and he's going to point your toe. So as you point your toe, you lift your head at the same time. And then you're going to drive your toe back and you're going to drop your head back. And now we're just kind of flossing that nerve that runs all the way down into the back of the butt. Now we're actually pulling the cord back and forth and sliding that through the spine. And so point and back, point and back. Now, as you start to feel a little bit looser there, you're going to relax first, take a quick second, and then you're going to do it again. But this time you're going to notice that you're going to be able to bring your leg up a little bit higher this time. And now we're going to floss that nerve again. Just kind of getting rid of all the inflammation and stuff that's just kind of holding that nerve in place. We can free up the nerve, free up the inflammation, free up the pain just by doing these exercises. Now, the second exercise, that might not be enough for you. You might feel like, oh, it's a little too easy, or it might be a little tough. There's other ways to do that nerve floss. And so the second exercise is we're just going to have him sit up. You're going to turn and face here, staying seated. Now we're going to kind of do the same thing, but now we're going to actually have our mid-back and our spine doing a little bit of that mobilization. So in his case here, we're going to go ahead and kick his leg forward here, and he's going to feel that stretch again on the underside of his leg, the posterior side of his leg. And as he points his toe, he's going to round his back out. Remember, point your toe, round, and we're going to put some tension along that sciatic nerve, and we're going to kick it back, and he's going to look back, look up, and then he's going to tension it again. Round and back up. Again, we're doing the same thing, but now we're just in a seated position, and we're utilizing our spine to kind of pull and tension that sciatic nerve along with the spinal cord. And up. Pretty simple stuff. Do this for about 30 seconds to a minute and see if that alleviates your pain. Now the third exercise is pretty quick also, but we want to try to load the positions, and we want to try to loosen up the hip in a different plane. So not just forward and back, we want to try to loosen up some of the muscles in a loaded position. So the last exercise that we have here is going to be called a hip airplane, but it's going to be stabilized, it's going to be supported. And so what I'm going to have him do is he's going to place his hands down on a table. Now, one of the biggest things I want you to remember on this exercise is don't put too much pressure on your hands. Let your hip do all of the work, okay? Let your hip do most of the work. If you feel like you're really off balance and you really need this, table or chair or anything that you're utilizing, then go, by all means, go for it. But you want to eventually move away from this. Now, the hip airplane, we're going to bring this leg up, or actually keep this leg down, bring this leg up into the air so everybody can see it. So you're going to kick this leg straight. You're going to work on a hinge right over here. And on the other side, we're going to rotate the hip down, 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 rotate the hip down. And we're going to put this in a different view for you guys as well. But we're going to rotate the hip down and we're going to rotate it up. So we're working in a transverse plane. We're also working in the frontal plane, in a different plane. So that way, we're not just working forward and back. Our hip is a very mobile joint. It's a ball and socket. So there's a lot of different ways that we could start to mobilize the hip. But in this case, we're actually adding stability. We're actually adding strength to the hip as we try to increase mobility. Now, I've said before, mobility is more than just stretching. It's an activation technique. It's a control technique around a joint. How much control do you have during these movements? Now, as he raises up, he's rotating all the way around. Notice that. He's kind of doing like a side kick here to really open up that joint as much as possible. And then he's going to rotate all the way down as much as possible to where he feels a small stretch onto that hip on the side. Okay? Let's change it up so that way they can see the other side. And so we're just giving you guys this different view right over here. So as he's going to kick his leg up right over here, you're going to really relax your arms a little bit. And he's going to rotate his hip down as far as he can, as far as he can, far as he can. And as you can see, he's stretching those muscles out right over here. And he's going to rotate all the way up into the air as much as he can. Now he's activating that side. So as he's here, he's rotating in. Go ahead and drop down. And ensuring that that ball and socket is getting the most out of its movement. And he rotates all the way up and then all the way back down again. As far as he can, stretching out the muscles and making sure that the joint is mobilizing within its socket. All right, you guys, so there's the exercises that you guys can try out for sciatica. Now, if the pain doesn't go away, again, I always recommend you guys check out with a professional. Check your physical therapist, check your chiropractors, check anybody in the area that can diagnose you and really see where the area is coming from. Is it a disc? Is it a muscle? Is it more than just any of those? So we want to make sure that you guys are staying as healthy as possible when it comes to sciatica, and we want to get rid of pain. You do not want to be living your life with these aches, pains, injuries, and it may have a detrimental effect on your lifestyle. Thanks again, you guys. Thanks again for joining us. I hope you guys enjoy those 3 exercises for sciatica. If you guys like what we're doing here, make sure that you comment down below, like, subscribe, share this page, share this information with any of your friends, your family, your colleagues, whoever it is that may be dealing with sciatica pain. We're here for you guys. We want to make sure that you guys are moving better and feeling better. Thanks, guys. Till next time.